some people are saying, should I just go out and get COVID? What are your thoughts, Pyle?
Mike, this is a question that parents are asking too, especially parents of young kids who they're reluctant to get them vaccinated. And the answer is an absolute resounding no. You do not want to go out and get COVID if you can avoid it. Number one, the illness itself can throw us some curveballs. We don't know which new variant might emerge. But number two, and more importantly, if you get the Omicron infection, if you get Delta, if you get any of the other variants, we know that your long-term risk of everything is increased. There's been evidence of brain atrophy occurring after COVID infection, cardiovascular disease, including stroke, heart failure, heart attacks, and thrombosis or blood clots, all substantially going up. And a more recent large study that looked at an increased risk of erectile dysfunction, fertility problems, all kinds of other things. So when it comes to our kids or ourselves, we just don't know the long-term effects of this, Mike. And I think if you can avoid getting it, you should.
Oh, I agree. And, add to that list long COVID in terms of the neurologic issues, the number seems to kind of be zeroing in around 30% of people will have long-term neurologic sequelae. One thing I'm very concerned about is that you may have long COVID if you get reactivation of the Epstein-Barr virus. And of course, as we saw recently, those people with MS, there was a 38-fold increase in their association with having had EBV or having EBV titers. So be careful, you don't want to come down with a protracted illness like that. And, the other thing is you just pointed, JAMA had a great article showing, some of the long-term cardiovascular effects in the elderly as well.
Yeah, exactly right. And I like to think of it like the chicken pox. When I was young, everybody would get the chicken pox. And now looking back, I wish I had never gotten it because now I have to worry about shingles and all the long-term consequences of that virus living inside my body forever. Now we have a great vaccine that can prevent that. So think about this in the same way. If you can avoid getting it, you don't want it to result in immunologic phenomena, neurologic, cardiovascular, all of those things. So just try to avoid getting it if you can.
Thanks, Pyle, for joining us. Thanks to all of you for joining us here at Snackable Health.